I've been a nurse for 33 years. I started as a CNA, and during the time that I was a CNA and going to school, I realized that nursing is the profession that actually spends time with a patient. And I felt that was very important. So I wanted to make sure that I devoted my career to actually spending time with patients and helping to influence their health outcomes. One of the reasons to choose nursing is because you can be anything you want to be. Most of us will start, like I started on med-surg, but then you see everybody go from there to something else. You can be anything that you want. You can work in a clinic, you can work in the home setting, you can work in the hospital, you can work everywhere from birth to death. You can be an adrenaline junkie and love critical care, or you can be somebody who wants to make sure that you see the outcome, not just the care that's delivered in the moment, but what's the outcome of that? And you see people go into that, go into long-term care, go into things that you're going to have that patient for a long period of time, not just 5-10 minutes or 5 or 10 hours.
I'm in the float pool, so I work on all types of units from the med-surg to the critical care side and sometimes some of the outpatient units. So I feel like I can interact and impact a lot of different patients in many different ways. My typical day usually starts, our shift starts at 7 o'clock in the morning. That's our official time. Usually get here about 6:30, 6:40 in the morning, start getting a report. Once we're done with report, I typically go and research my patients, look up everything up in the computer, and then I go start getting my medications ready and go start assessing my patients. Each day is very different. In nursing, we always joke that it's so hard to plan your day. Because you could have the perfect plan in writing. This is what I'm gonna do now, then this, then that, but then something happens and your plan is out the door. That's also one of the great things too, is that you're not doing the same thing over and over. It's not repetitive. You're doing many different things each day.
I've been working on the acute care unit for about 2 years now. The bond and relationships that I have made on that floor is absolutely amazing. We have great teamwork, whether it's between just the PCTs and I, the nurses and I, even the doctors. The doctors are great, especially the hospitalists. The most rewarding part about the nursing profession is that you don't know what the day-to-day will bring you. There are days where I don't get to sit down because I'm giving baths, I'm changing bed linens, I'm providing all these cares that are right there. And then there's other days where I get to just sit one-on-one with a patient who isn't themselves at that moment, so you just sit there and you listen to them, you listen to their stories, you play cards with them. Most people who come to the hospital are at their lowest points, so you have to just be their friend and form that relationship with them.
I enjoy the patients the most. The patients, I just love talking to them. I don't just talk to them about their disease processes. I actually get to know them as people. I see pictures of their grandkids. I see pictures of their children. I get to know them in the clinic setting as people and not just patients. So they become very close to me. When I get patient into a room, we check their vitals and I go over medication lists and any allergies that they may have, their reason for coming into the clinic, and going through the symptoms that they're experiencing for that day. If you have really strong communication skills, this is really a good fit for you, as communicating with your patients is very important, and knowing that you care about them is really important. It shows that you have compassion for what they are going through. A career in healthcare has a lot of flexibility, and as your life changes, you get married, you have children, just different things that happen in your life, you can always find a way with the different hours or different positions that it can accommodate to your lifestyle, and then you can achieve your goals still and maintain your family life and your work life.
That's another great thing about nursing is your schedule. We're required to work 3 12-hour shifts. Sometimes you can work those 3 days in a row, Monday, Tuesday, Wednesday. You're off, Thursday through Sunday. Some days you can work 1 day on, 1 day off, and just basically you can adjust it to whatever you have going outside of work. So it's very flexible. So that's a really unique thing about nursing or working in the hospital setting is that it can be very flexible. Some weeks I have 5 or 6 days off in a row, and that's without me using vacation time. So I know sometimes people get very excited, people have office hours. Oh, we have a 3-day weekend. I have a lot of those.
If you don't know what you want to do, you're starting on the right course by being in this experience, to start to explore what is out there. And when you're exploring, make sure that you are paying attention. It's really easy not to pay attention, but pay attention. If you love science, pay attention, because these careers, and especially nursing, is heavily scientific. If you are a very caring person and you know that caring is your core, then take that and start to expound on it. Start to grow with it, but always pay attention to the science part. And then understand that where you start is not where you're gonna finish. I didn't start to be a nurse. I didn't start to be an administrator. In fact, my goal in life was to have a job that I never wore a tie, and that I never had to go to do public speaking. And now 2 things that I have to do a lot is wear a tie and public speaking, but that's because I was open to the opportunity. Always be open to the opportunity. Never be closed to what you are going to learn about.